Welcome to Live Greater, a health and wellness podcast brought to you by the University of Maryland Medical System. We put knowledge and care within reach, so you have everything you need to live your life to the fullest. Sneezing and wheezing can be signs of seasonal allergies. But what if you get hives or swelling or you can't breathe all of a sudden? You might be having a serious allergic reaction. So today we are talking all about allergies with Dr. Scott Berger, the Interim Chief Medical Officer of Urgent Care. So Dr. Berger, we're talking about allergies today. To start us off, how do you know if you are having an allergic reaction?
So great question. A lot of times what people will feel is they might notice the development of some rash on their skin. They often look like what we describe them as hives. So they're sometimes the size of a nickel or a quarter, red welts on the skin that are itchy. Some people also might feel a little scratchiness in their throat or a little tingling on their lips. Those are typically some of the symptoms that people will experience with a mild allergic reaction.
Gotcha. And what are some things that might cause that reaction?
You know, there's a lot of different things that can cause it. Foods are obviously a big thing causing allergic reactions for folks. Some people have allergies to different ingredients within medications. Those are other things that can cause an allergic reaction. A lot of people have environmental allergies, so things that they can inhale or breathe that can trigger allergic reactions. And then you also have contact reactions that are allergic reactions where something touches your skin. You know, somebody who has very sensitive skin might have an issue with a perfume or a deodorant or a soap that can cause a localized allergic reaction.
So with all of these things that people can be reacted to, how do the reactions range? Are there some that are worse than others?
Yeah, so you start with very mild, which are those local reactions and or hives, where there's some itchiness and scratchiness to the skin. There are more serious allergic reactions where other systems other than the skin start to become involved. So when people start to have a scratchiness in their throat, or they develop any wheezing, or actually another symptom that sometimes develops, but it's a more concerning one, is if they have the trouble breathing and or any gastrointestinal upset. So actually sometimes people develop cramping in their stomach and or diarrhea. If they have that in conjunction with a rash, that's a real emergency and the sort of thing that they need to be seen for right away, because those are signs of anaphylaxis, which can be a fatal condition if not treated.
Well, that leads me into my next question, doctor. What do you do if you are having an allergic reaction?
So mild symptoms, itchy eyes, itchy skin. Most people could try taking some over-the-counter antihistamines. Antihistamines are medications like Benadryl. Other ones that aren't quite as strong are things like Claritin, Zyrtec, and Allegra, which work well for environmental allergies, like when people get hay fever, but often aren't as effective when somebody's having an allergic reaction. So Benadryl is probably your best bet. If they're having a contact allergic reaction, topical steroids often help as well. Those are cortisone creams. So you'll see it listed as cortisone 10 or hydrocortisone. All those are one and the same thing with the same ingredient. That'll help with some of the localized allergic response, which is swelling at the site, itchiness at the site.
Well, let's focus some more on relief. You mentioned a bunch of medications, mostly over-the-counter, that can help, but are there any other medications that you could take for allergic reactions?
Not without seeing a doctor. When you start having a reaction that extends beyond what you can get with those types of medications, you really do need to see a doctor. And so there are stronger topical prescriptions. We use oral steroids for people who are having more significant allergic reactions, where they have swelling of the lips or tongue, they're having any wheezing, difficulty breathing, those sorts of things. And then obviously, if somebody's having an anaphylactic reaction, I think most people have heard of an EpiPen. There are instances where we prescribe those for patients so that they have them in case they encounter the same trigger, whether it's a bee sting, a peanut allergy, something that they need to make sure that they have it available for them in an emergency situation.
Well, doctor, as we wrap up here, are there any steps that we can take to even prevent an allergic reaction from happening?
So the measure of prevention is really to know what you're allergic to. And if you're not sure, There's allergy testing that can be done either through your primary care doctor or an allergist to try to identify what those triggers are. And once you know what those are, trying to avoid them. That's really the most important thing that you can do. If you know you might be exposed to something, sometimes if it's a real mild reaction that you get, some people might pre-treat with a little bit of Benadryl, something like that, to just try to prevent any of the allergic reaction. And that's okay as long as the reaction that you're experiencing has been historically quite mild. But you just need to be careful to avoid exposure to whatever the inciting agent is.
Absolutely. Well, doctor, are there any last tips or tricks for those suffering with allergic reactions that you'd like to share?
I think always having some cortisone cream, some Benadryl in your home are great things to always have around the house. If you get an allergic reaction, to seek medical attention, to either call your primary care doctor, go to your local urgent care center, or if somebody's having a more serious reaction, don't hesitate to call 911 to get help, because the ambulance crew, the paramedics, would be able to administer treatment before they got to the emergency room. So don't hesitate to utilize those medical services when they're needed.
Wonderful. Well, doctor, thank you so much for your time today. We loved having you on the show. This episode is sponsored by University of Maryland Urgent Care. Offering care for a variety of non-emergency illnesses and injuries, Urgent Care focuses on providing a superior patient experience. The caring team at Urgent Care ensures that patients receive high-quality health care that is convenient and affordable. With multiple locations throughout Maryland, you can find an urgent care center near you or schedule a telemedicine visit today. Find more shows just like this one over at umms.org/podcast. And thank you for listening to Live Greater, a health and wellness podcast brought to you by the University of Maryland Medical System. We look forward to you joining us again.